with over 17% of the nation's GDP being spent on healthcare services. We've got to figure out a way to deliver better care at a cheaper cost point.
When we provide a data infrastructure that combines operational, financial, and clinical data, that unified data set unlocks the keys to actually bending the cost curve down as it relates to delivery of care. When you can look at data in the continuum, you can understand what it takes to basically change behavioral patterns in the delivery of care to get the optimal outcome at the lowest cost. And so the key for us is to deliver the infrastructure that allows the healthcare systems to perform their jobs significantly better.
EHR platforms are just now becoming prevalent across the medical landscape. What's more, there are more and more devices that are rolling out that are throwing off massive amounts of data. Patients are providing data and feedback on how they're doing. They have devices in the home that's providing data. So there is a ton of variety coming to this space, and it's more than the healthcare space can really handle. We had to be able to walk into some of the largest healthcare organizations on the planet and work with not just a small piece of their data, but all of their clinical data, all of their operational data. And so we needed to be smart and innovative about the technology we chose.
We needed something that was both cost-effective and then could also grow with our data needs.
So we couldn't think about traditional technologies. And I'll tell you, having that challenge from day one made us a lot stronger company. And that's really what drove us towards Hadoop and, for that matter, Cloudera.
We've got 3 applications. We've got Explore, which is a research application, Measure, which is a platform for operationalizing quality measures, and Registry, which is a platform for manifesting registries.
So we really look at solving problems with the right kind of technology. And for us, storage, high capacity index, and analytics, Hadoop really made a lot of sense.
So, we didn't invent the quality measure. Quality measures have been around for decades, but the ability to generate these measures on a rapid basis and also support not just a couple dozen measures, but hundreds of measures, and also implement the complex attribution logic and then manifest this with a slick user interface on top, that's revolutionary.
If you want to understand, for example, how many folks are a diabetic in your database, that would normally take multiple queries, a lot of analysis to understand what that population looks like. So our customers would go in and ask that question and get an answer in less than a second.
We would be spending literally millions of more dollars than we are today on relational database technology and licensing for that, and that wouldn't be adding value to our business. Again, those types of technologies are important, but they're important in their place in certain areas, and we continue to use them. But for the kind of big data analytics, big data storage, big data processing, Hadoop is a perfect solution for that. And again, it has brought opportunities for us to rechannel those funds, that capital, in directions of being more innovative, bringing more products to bear, and ultimately hiring more people for our company as opposed to buying licenses.
I definitely see value in Cloudera Enterprise because we have a non-trivial systems operations team. Like I said, we live and breathe it. This is our business. And so any help that we can get in terms of operational support and tooling around the management of the cluster is critical for us. I've already benefited from Cloudera's extensive involvement in the open source community.
So I would tell you that from my partner perspective, Cloudera is probably one of the most influential that we've had throughout these years.